Hey, good morning, everyone. It's great to have so many people here. Earlier this week, I thought it was going to be raining, so this is a fantastic day for us to celebrate. And we are streaming live on our Douglas County Hospital Facebook site because we have a lot of staff here in the organization that aren't able to be here because they're busy working right now. But how many are you excited about today? Yes. We are too. We are extremely excited, and for us that have really kind of tried to keep this a secret, and the suspense associated with this, hopefully the build up to this day has been something that people have been looking forward to. You know, our hospital and Douglas County Hospital, the Alexandria Clinic, and Heartland Orthopedics are real excited, and this is a big day for us. We've, you know, 6 and 7 years ago we merged, became one organization, but yet at the same time we continued to operate under the same name or different names as individual entities under the name A Service of Douglas County Hospital. And the Service of Douglas County Hospital, while Douglas County Hospital has had a great reputation for healthcare in our community, we felt that the name was a broader name was much more fitting for us as an organization. We serve a very broad region. We have 186 zip codes that we serve for orthopedic patients, 100 zip codes for our OB patients and so forth. So we certainly have a much broader regional presence beyond Douglas County Hospital, beyond Douglas County and so forth. So I just want to say a shout out again to our staff at the Alexandria Clinic who are watching this live over at the Alexandria Clinic. I also want to shout out to our staff at the Heartland Orthopedic Clinic. Even though they're right here, they are probably, many of them are busy working over in the clinic as well. And to the Heartland Orthopedic staff in Wilmer, as well as at our Alexandria Clinic Osakis. Thank you for joining us this morning. I also want to just say thank you to our community here in Douglas County, to KXRA, to the Echo Press for being with us, the Voice of Alexandria and so forth for being with us this morning for this, to help us celebrate this special occasion. So, and also a big shout out again to our staff here, right here at the Douglas County Hospital as well. So, I am going to introduce our board members. We have a number of them with us here this morning. Dr. Eric Nelson, who is our board chair for Douglas County Hospital. He'll be speaking in a few minutes. And Jim Stratton, who is our vice chair and a county commissioner, will also be speaking. And then also Charlie Meyer, who is the immediate past chair. Keith England and Kevin Kapishke, Diane Lopez, Owen Miller, Larry Ortloff, and Jerry Rapp. So we really appreciate, and I really appreciate the leadership that they provide in helping us chart the strategic direction for our organization. And this today, what we're celebrating, is really very much about that. Also with us this morning are our Chief Medical Officer, Dr. Deb Dittburner. Behind me here, she is our Chief Medical Officer and a family practice physician at the Alexandria Clinic, and Dr. Mike Bristow, who is our Chief of Staff for the medical staff and also a family practice physician at the Alexandria Clinic. And then Dr. Ron Varant is also with us here this morning. I saw him back here as well, and we're real excited, and I'm sure there are other physicians and here that are probably with us as well. I also want to introduce our senior leadership team for the organization. Mike Doyle, who is our administrative director for Heartland Orthopedics. Celeste Gardner, who is our director of human resources. She wasn't able to be here. She is with her daughter in Colorado today. Margaret Kalina is our chief nursing officer and director or vice president of patient care services. Brad Leonards, our administrative director at the Alexandria Clinic. Nate Meyer, our chief financial officer, and Eddie Reif, who is our director of community relations and public relations. And I just want to say a special thanks to Eddie. This has been a very stressful and time for him, He is very relieved for today and this celebration that we are having today. And I also just want to, a number of our staff in the organization, we put a call out to a number of our staff a while ago to be brand ambassadors for us, really to help communicate why we're making this change within the organization, and it was really to help to get that message out and so forth. And we had over 50 of our staff. We asked for volunteers from every single department, and I think we got volunteers from every single department to help to spread that word. They will be available afterwards. Some of them are wearing Ask Me Why on their name badges and so forth, so ask them why when you come in afterwards as well. They'd be happy to talk with you about that. And then of course, all of our staff. I see a number of our staff here as well, and again, we're excited about this day that we get to celebrate together. I want to get us off to the right start here today, and I couldn't think of a better way to do that than to invite Sister Patrice up to say a blessing for the day today. Sister Patrice was the Director of Human Resources for our organization for 44 years. Prior to that, she was the Administrator of Our Lady of Mercy Hospital for 10 years here in our community. And when you think about pioneers of healthcare in our community, the Franciscan Sisters of Little Falls, and Sister Patrice and Sister Sharon, who are with us here today to help us celebrate that, is just a great occasion for us to be able to have them here. So I will let Sister Patrice lead us in a blessing.
Thank you. I'm very happy to be here and very proud to be here too. So if you just bow your heads and we'll have a brief prayer together. Father in heaven, we thank you for our hospital, which we are renaming today. Bless this building and all who are employed here and those who have come for care. Grant that all the activities and treatments that take place here will bring healing and also build up a community spirit. Through the labor of their hands, may they bring God's blessing upon themselves and others. May we always welcome all who need medical care, regardless of their race, religion, or financial status. Father, we praise you and ask your blessings through Christ our Lord. Amen.
Okay, and now let's get on with the much talked about and anticipated unveiling ceremony. We've been looking forward to this day for a long time, and we're excited to share this special occasion with our staff, friends, and all of the people throughout the region who we've had the privilege of serving here in the community. Yes, we're celebrating our name change today, but we are known for, and always will be known for, the high-quality, compassionate care that is provided by our staff and physicians. It's what happens within the walls of our organization that really is who we are and defines who we are as an organization. Our staff and physicians throughout the decades have been encouraged numerous times, have been recognized numerous times, both regionally and nationally, for quality healthcare services that are provided. So today, while we're celebrating our new name, I also want to just take a few minutes to acknowledge just some of the recent recognition that we've received as an organization. Recently, we were recognized as one of only 8 hospitals in the state of Minnesota to receive a 5-star rating from the Center for Medicare and Medicaid Services. Douglas County Hospital was also recognized as one of only 2 hospitals in a 100-mile radius of Alexandria to receive an A grade rating from the Leapfrog organization, which is an organization that evaluates patient safety within hospitals. Heartland Orthopedics was recognized this last year in U.S. News and World Report as the higher performer for total hip procedures. And the Alexandria Clinic was recently rated as the #1 in the state of Minnesota for breast cancer screenings by the Minnesota Healthcare Programs. We are also recognized as the busiest level 3 trauma center in the state of Minnesota. So again, thank you to our staff in the organization for all that you do to provide the compassionate commitment to excellence that we provide to our patients here in the community. At this time, I'd like to introduce Jim Stratton, who is our Vice Chair of the Board of Directors, to share a few comments as a County Commissioner. And then I will also invite Dr. Eric Nelson, who will follow him, to share some comments as the Chairperson of the Board and physician from the Heartland Orthopedics.
Don't you love it when a speaker gets up and opens a book in front of you? Sorry. Good morning. As Carl said, I'm Jim Stratton, and he told you what I'm involved with. It's a privilege to be here with all of you. This is a historic event. It really is. As a token old one, it's I guess fitting that I have the task of sharing some history about healthcare in our county and to pay tribute to those who have been integral in making it. So, since it's history, I'm going to be reading some of this because I've got a person back here that's going to correct me if I get this wrong. So, with today's rebranding of our hospital, some may feel that we're losing part of our history, when in fact we're adding to it. Not unlike those that have done so for many years in the past. Like them, we are renaming, realigning to meet the changing needs of our community, county, and region. Now the history lesson. Now don't everybody glaze over. I know I was in history class once and I kind of just sit back and, okay. The story of how healthcare in Douglas County has changed over the past 119 years. It was in 1899 when our first hospital, called Boyd Hospital, opened on the corner of 9th and Elm with a whopping 6 beds. 8 years later, they merged with Dr. Hensel's practice and they renamed it St. Luke's. Shortly after, in 1917, a second hospital opened called Mercy Hospital. Not to be outdone, Dr. Tanquist established a third hospital and called it, what else? Tanquist Hospital. It was located on the wonderful shores of Lake Winona. He ran it for 17 years and then invited the Franciscan sisters to take it over. In 1944, it was renamed Our Lady of Mercy Hospital. So are we getting the drift? This is not new. That first year, they admitted 950 patients and delivered 148 babies. The demand did not slow down. So 11 years later, they added a 40-bed wing. Even then, there was a shortage of beds. So the county, in our infinite wisdom, opened the Douglas County Hospital on this very site. The patients from St. Luke's Hospital were moved to the new county hospital, and St. Luke's closed. So anyone lost yet? Keep with me. There's more. For the next 14 years, the 2 remaining facilities ran independent of each other. Of course, we can't leave things alone. Eventually, talks began to better serve the community's needs, and the decision was made to merge. That took place in 1969. The hospitals continued to operate, one as DC Douglas County Hospital North and the other as Douglas County Hospital South. In 1974, Douglas County South added a 104-bed addition, and Douglas County North closed. In recent history, there have been several major modifications. The one you can see at the end of the hospital, They've been additions to the current hospital, and they're all focused on the continued improvement of health care that meets the highest standards with the best interest of our patients and the community in mind. So this, as they say, is the story of healthcare in Douglas County. But for those of you my age, remember Paul Harvey, and there's always a page 2. Today we turn that other page and enter a new chapter of healthcare, and I hope you see it as a story that centers around you. I'm looking forward to the rebranding and all the potential it affords the hospital. I hope you are all excited to look to the future, guided in part by our past. Thank you.
Thanks, Commissioner Stratton, for that perspective on the collective history of medicine in Douglas County. As important as it is to know where we are going, it's also important to know and remember from where we have come as a medical community and a hospital. My name is Eric Nelson, and it's my privilege to serve this community as our hospital board chair. I'm a partner at Heart and Orthopedic Specialists and have been a proud resident of Douglas County for the past 9 years. Now, I know that this will never allow me to be a native Alexandrian, but I get it. And that's okay, because there's a lot of pride in this community. Even in the time that I've been back in Minnesota, there have been a lot of changes in our medical community. I actually signed a contract with a group called Alexandria Orthopedic Associates about 11 years ago. The name changed because of the group's regional influence and geographical scope of care that goes far beyond the borders of our county and the local area. And as much as it was a difficult change because of the legacy of 30 years of Alexandria Orthopedic Associates, the last 11 years of Heartland Orthopedic Specialists have allowed the practice to grow and be established as a leader in orthopedic excellence in our region. Just a couple of weeks ago, we celebrated the 5,000th joint replacement patient to come through the Joint Replacement Center, and that's only since its inception in 2007. 9 years ago, the building that is standing behind me over to this side was really just a bunch of steel I-beams as I pulled into town, and not much more. What a difference a decade makes, and it's exciting to see our local hospital continue to grow. In recent years, we've been able to form a collaborative, unique relationship between physicians and administration, which has allowed us to improve efficiencies, control costs, and most importantly, optimize care for our patients who also happen to be our friends and neighbors. I'm really excited to take our collective brand to the next level, which reflects the regional influence of our healthcare system that reaches far beyond the borders of Douglas County. Thanks.
Thank you, Jim, and thank you, Eric. So again, as I mentioned before, the idea came to light really about 6 to 7 years ago, but it was really only about 18 months ago that we seriously started talking about it as a board, at the board level, strategically and so forth. This was a very thoughtful and inclusive process that involved many stakeholders, both inside and outside the organization, as we went through the process of trying to decide whether or not we should move forward with this new brand. But you were always at the top of our mind through the entire process. The principles guiding us every step of the way were also our mission and our values. And these will not change. And although our name is changing, we will still be a county-owned hospital anchored by the same team of healthcare professionals you have trusted for years. Our new name is simply that evolution of a beloved brand in our community, brought forth by the next generation of passionate stewards of locally owned healthcare. And now that suspense is about to end, and the much anticipated time for the unveiling is come. And I have to admit that I'm a little bit nervous. I shared that this morning with a few people because much like I put my coat on and my clothes on this morning, I've known about this name for a while, and it fits. I think it feels really, really good, but I can about imagine that there will be gasps, maybe cheers, hopefully a lot of cheers, or I love it, or what were they thinking? But at any rate, it's change. And change is not always easy, and so forth. So I sort of feel like I'm at a wedding and about to introduce the bride and the groom. And of course, they aren't the bride and the groom, but at this time, I'd like to invite two of our brand ambassadors, Jason Norheim and Jody Anderson, to come forward as we count down the unveiling of our new name. Following the unveiling and the gasp and shock and so forth, I will give you a little bit of a moment to absorb the new name, but don't leave. Stick around, because I really want to spend a little bit of time just sharing with you how this name came about. So, let's do a countdown, everybody. So do you have it already? So, countdown from 5, 4, 3, 2, 1. We need to do it again? 5, 4, 3, 2, 1. Right. Are you surprised? All right. So I think as a matter of introduction to this new name and the significance of this new name, I need to share a little bit. I need to share our mission statement first. Our mission states that our passion and purpose is to strengthen and nurture the health and well-being of our family, friends, neighbors, and communities through every season of life. Our new name better describes our passion and purpose, not just our ownership and location. The name Alomere is a combination of the Latin alo, meaning to nurture or strengthen, and the Old English word mere, or lake. These two concepts honor our passion and purpose along with our heritage and location. Alomere Health is a name that feels both soothing and strong, one that honors our specific culture and community. And it's also a name that better embraces the wide range of people who receive care here from distances far beyond Douglas County, thanks to our strong reputation for quality health care. Our naming creates new opportunities. When Douglas County Hospital, Alexandria Clinic, and Heartland Orthopedics merged not very many years ago, it opened the doors to new and exciting opportunities, and we worked together to redefine healthcare in our community because we shared a vision to create a locally owned and integrated relationship as healthcare providers. Similarly, Alomere Health is a name that has never been defined. You will not find it in the dictionary. So we can make it truly our own, opening doors to new and exciting opportunities as we continue to expand programs and services to meet the needs of patients throughout the region. Alomere is a name that we can be proud of to call our own, something completely unique to us. Together, Alomere Health, along with our team of healthcare professionals, will take us well into the future. So I'm incredibly proud of our providers and our staff and our journey that we're on, and I'm excited we're here today and that where we're headed, and I'm confident that as Alomere Health, we'll continue the great legacy of care that you have come to know and expect. And we just want to thank you for trusting us with your healthcare services and allowing us to meet your needs for the past many years. So at this time, this concludes our program, and we have donuts inside from Country Blossoms and coffee from the Common Ground that we will be serving, and we would invite you to come inside and enjoy the celebration with us. Thank you for coming.